going to be going over all the features of the Dolphin Neurostim. We're going to be going over how to find points, use them, treat conditions, how to treat scars, and how to set up your vagus nerve stimulations. We have a lot of things going on tonight. We have about an hour of instruction time, and then we have about 30 minutes for questions and answer. So if you have questions, please do type them in the chat box, and I will get to them as soon as I can once we get to the question and answer section. And we may have some time for you guys to ask live questions as well. I know that we have a lot of people attending tonight, so I'm going to try and do my best to cover everybody's needs. Let's see here. Let me make sure I got everything. All right. So I've been using this modality for about 25 years. I've been a therapist for about 30 years. I've used it in neurology, neurosurgery, women's health, spine rehab, and chiropractic settings. I instruct for military. I instruct for private clinics and hospital systems. So anyway, this is a big part of my life. I use this stuff regularly. I generally start my day at about 8 o'clock in the morning. I do about 10 hours of therapy a day. And of that, about 20 to 30 minutes of each of my therapy sessions is using Dolphin Neurostim. So I hopefully can share with you some little tips and tricks I've garnered along the way to make your journey a little bit easier for using this. It is a simple system, but there are some little tricks you need to know. So starting with the, sorry about that. Starting at the tip of the Dolphin Neurostim, we have a spring-loaded biocompatible tip here. You'll notice if you push on it, it does retract. So when you go to clean the Dolphin Neurostim, we do recommend that you use an alcohol wipe. Don't pour liquid down in here because there's a conductive medium around the spring. And if you pour liquid down in here, it can interfere with the conductivity of the device. Moving up from there is a black button. You'll notice when I push that button, absolutely nothing happens, and nothing will happen until I turn the unit on. But when I turn the unit on, this will be the button that I use to start treatments. As long as I'm holding that button down, I'm doing a treatment. But as soon as I release that button, the treatment is over. So you can't just touch this button and expect anything amazing to happen. You're going to have to hold this down and count the number of beeps that go along with it. So up from there is a little roller switch, and you'll notice on that roller switch that it says on and off and up and down on either side of it, or high and low. So this little roller switch is going to do three things for you guys. It's going to allow you to turn the Dolphin Neurostim on. It's going to allow you to adjust the intensity of the stimulation. It's going to allow you to also test the battery of the Dolphin Neurostim. So that's an important feature. So we're going to check that right now. When you turn your Dolphin Neurostim on, when you roll the switch on, you should see a nice green light like this. But if you happen to see no light like this, like if nothing comes on, so you hear a tone and nothing comes on, then that tells you it's actually time to change the battery in here. So anytime that light is not on when you turn the Dolphin Neurostim on, it's time to change the battery. So to change the battery, you're going to need either a pocket knife or a screwdriver or a coin. It doesn't really matter which you have. Let's see what I've got handy here. I've got a flathead screwdriver. So on the back of the Dolphin Neurostim, you'll notice there's a screw at either end right here. And I highly, highly, highly recommend that you do not take these screws out. One of the biggest problems we have is people actually calling the company because they've tried to change the batteries in this device because they noticed the battery was low. They've taken the screws out and taken the device apart, and parts fly everywhere, and they can't get it back together, and they have to send it back to have the Dolphin Neurostim put back together. And when you take it apart, you void your warranty, and there's a whole bunch of things that happen that you don't want to happen. So instead of that, you'll notice conveniently located for you right here is a battery compartment. There's a little slit right here at the top. If you take a knife, a coin, or a flathead screwdriver, you can pop that open. And you will see inside there's a standard 9-volt battery. So we're going to give that a little sharp whap there. And you'll see that the battery comes out. And inside, you'll notice there is a diagram that shows you how to insert the next battery. We actually do recommend only 3 batteries for the Dolphin Neurostim at this point in time. Let's see if I've got examples of the 3 batteries you guys should use. I should have them in my little box here. We recommend Duracell batteries. We recommend Energizer batteries, and we also recommend the Panasonic batteries. Let's see if I've got one handy here that you guys can see. I know that I do. Some of the Dolphin Neurostims, I don't see one. But anyway, some of the Dolphin Neurostims actually come stock with the Panasonic batteries. So any three of those batteries are fine. Oddly enough, other batteries may or may not work. So if you go outside of those three batteries, you're sort of taking matters into your own hands. You'll notice with the Dolphin Neurostim that there's no little set of wires and a pad to put on the 9-volt battery. It's just a compartment that has a couple of press, sort of, I guess, what you would call press leads on the end here. So in the world of batteries, all AA batteries are the same. All AAA batteries are the same. C batteries are the same. D batteries are the same. 9-volt batteries actually come in different sizes. So because of that, there are 3 batteries we recommend. If you go beyond that, some batteries are actually going to be a little bit too short. So that means when you put them in the Dolphin Neurostim, they're going to rattle back and forth, and you're going to get intermittent contacts, and that's actually going to affect your ability to deliver good treatments. If you get a battery that's too long, if you look inside the Dolphin Neurostim, you're going to see there's a little plastic post right up in here. And if you get a battery that's too long and you try and jam it down in there, you could actually crack that post, and it affects the whole structural integrity of the case. So we don't recommend using anything other than what we told you guys. If you do decide to venture out onto your own and try other batteries, I will strongly recommend you stay away from cheap dollar store batteries. They really have a tendency to dump all their voltage at once, and that can actually damage the electronics inside the Dolphin Neurostim, or for that matter, any other 9-volt electronics you happen to have. So stick with reputable batteries and you should be good. So you're going to take whatever battery you're going to place in the Dolphin Neurostim. You're going to look at the little diagram we have here, and you're going to put it in there. When you go to put the battery door on, this is a really, really tight fit. So you're going to slide this in here, and it's going to feel like it's either not going to fit or it's going to break. So there's going to be a really sharp pop when you insert that in there. But once you do that and you turn the Dolphin Neurostim on, you will notice that, well, once you turn it on, you'll have a nice green bright light. If you don't see that light, either you have gotten a battery that's not charged up properly, or you need to flip the battery around or get a new battery to go in the Dolphin Neurostim. So in the world of 9-volt batteries, about 1 in every 95 to 100 batteries is actually dead when you buy it. So sometimes you will buy a battery that's actually dead. That's just something that happens in the world of batteries. So that's a little statistic to know. All right. So now we turn the Dolphin Neurostim on. We've established the fact that we have a good battery. So we're going to look at the other features of the Dolphin Neurostim. So this little roller switch right here, if we roll it up during our treatments, that's more intense. So when we turn the Dolphin Neurostim on, that's the lowest setting. And the more we roll this little roller switch, the more intense the stimulation is. And then if I push this button now with the Dolphin Neurostim on, you will hear a beeping. You'll notice that the Dolphin Neurostim blinks. And there's one more button right up here. If I push this button, you will notice the Dolphin Neurostim goes silent. But if I turn it over, you'll see that it's actually blinking. So this is like a timed treatment button. So if you push this button, it automatically starts doing treatments, and you don't have to hold a button down on it. And that's going to be useful when you guys are doing sometimes scar therapy. Sometimes you're going to use it when you are doing vagus nerve stimulation, and you're going to use it sometimes if you get into advanced courses. It's a really useful feature for doing concussion treatments. And I used to have a stepdaughter who was autistic, and she really, really, really hated like loud noises. And I could use this to treat points in her ear, acupuncture points around her ear. So it's a useful feature for that as well. If we turn to the back of the Dolphin Neurostim, you will notice there's a metal plate right here. And this metal plate, whenever you're doing a treatment, you need to make sure your thumb is on that metal plate. So these devices are designed to be held like this, so that they're cradled between your index finger and your thumb, so that you have good, fine motor control. A lot of the points you're looking for treatment, and this device does actually find motor points, acupuncture points, and trigger points. And it does that by measuring how conductive your skin is to electricity. So when you do this treatment, you need to be able to use the heel of your hand as a fulcrum and to be able to use the tip of the device to locate points. So what you don't want to do is get above the skin and start kind of poking around. That's really not going to yield you very good results. So again, hold it like this and you're good. I see all kind of odd ways that people try to hold this device. They try and turn their hand over and do odd things like this, and that just doesn't work very well. So in a minute here, I'm going to show you guys how to use this device to find points. But before we do that, we need to talk about a couple of other features on here. So we have two slider switches here, and you'll notice the bottom one is marked wet, dry, and normal. Let's see if I can get the camera to focus for you guys here. So this little slider switch doesn't do anything for the intensity of the Dolphin Neurostim. What it does is it actually helps you find treatment points. So this device, like I said before, finds myofascial trigger points, motor points, and Chinese acupuncture points. And it does that by measuring how conductive your skin is to electricity. So if you ran off to Home Depot or Lowe's and grabbed an off-the-shelf ohm meter, you could run that around your body and find the areas of your skin that were more conductive to electricity than others. As it turns out, your skin is not particularly conductive to electricity, but acupuncture points, motor points, and trigger points are all much more conductive than the surrounding tissue. So if you actually watch the dial, the conduction dial, I guess you would call it, on an ohm meter, you will see areas that are highly conductive. All of those areas are trigger points, motor points, or Chinese acupuncture points. So this has an ohm meter built into it, but there's no dial that you have to watch. Instead, you have to look at a light and you have to listen to a tone. So what you have to realize is not everybody has the same skin. So some people have very, very dry skin. Like if you live in a very cold, let's say you live in Minnesota and it's wintertime and the heat's on all the time, you're going to have very dry skin. So that's going to make your skin less conductive. So for a situation like that, I would slide the slider switch here over to the dry setting. But if I lived in like Florida or Georgia or Alabama and it was summertime, my patients were coming in and they were really sweaty, their skin would be very conductive to electricity because sweat is salt water and salt is very conductive to electricity. So it would actually slide this little switch over to the wet setting. But in a climate controlled environment in, let's say, the middle states of the United States, I would put this just on the normal setting and you should be good. So play with that a little bit. The first time you use this, I would use the dry setting because that's going to be the most sensitive of the point finders on there, and that should help you out a fair amount. If you move up from there, you're going to notice that there is a little slider switch that says polarity right here. And there's a negative polarity, a positive polarity, and a plus minus symbol here. So that's a biphasic symbol. So this unit does use direct current, so you can change the polarity of the equipment. You can use a negative polarity, which is what you're going to use most of the time. That's for bringing things down. So in the world of acupuncture, things are either going to be excessive or they're going to be deficient. If they're excessive, you want to bring them down. If they're deficient, you want to bring them up. Most of the conditions you guys are going to treat that are in the books that you have that come with the device are conditions that are excessive. So that's going to be things like muscles that are too tight, nerve impingements, nausea, diarrhea, shingles, migraine headaches, MS flare-ups, seizures. All those are excessive. So if you look in the books that come with the Dolphin Neurostim, you will notice there are a series of protocols. And by each of the protocols, there's actually, if you look, they're going to be numbered points, and they're going to have a minus or a plus symbol next to each of the points. So if you don't really know which polarity to choose, the guidebooks that come with the device are actually going to tell you. And as a general rule of thumb, 98% of the time, if you just kept this device on the negative setting, that would be the correct setting because most of what you're going to be treating is excessive. However, sometimes there are conditions that are deficient that you want to treat. So what are conditions of things that are deficient? You might have somebody who has Bell's palsy and their face may be drooping on one side. So you might want to tonify the muscles in that area to bring up the tone. You might have somebody who is adrenally just kind of shot out, like they've been on high sympathetic arousal for years because of a car accident or, life stress or whatever. But anyway, they have really high sympathetic tone. So those people tend to be adrenally deficient because their adrenals are always working. So in the world of acupuncture, that's your kidney energy, that's your life essence. So if you want to bring up your adrenals and make them more robust, what you would do is switch the Dolphin Neurostim to the positive polarity and treat kidney points. Or if they had something like Bell's palsy, you would be treating the points on the face on a positive polarity to bring it up. Then we have this other setting on here that is this biphasic channel. So you have this plus minus symbol here. And that's a setting you're going to use mostly when you do scar treatments and most when you do like some vagus nerve stimulation stuff. You're going to find it more in scar treatments, but there are some other uses for it as well, which we'll go over in a few minutes. So that's all the features on the Dolphin Neurostim. The thing I cannot emphasize enough to you guys is every single time you turn this device on, you really want to make sure that you have a nice green light here. The biggest single problem we have in the customer service end of things, which is not what I do, but the people who are into the customer service end of the Dolphin Neurostim folks, is they have a lot of people call who have problems with their Dolphin Neurostim. It's not working properly. It's not finding points. It's not doing treatments. And the first thing they ask them is, hey, turn it on and make sure you have a green light. And about 98% of the time, it's just that people have not changed the battery in this device. So you always want to check that. The batteries should last you quite a while. I can tell you as a therapist over the years of doing this, I get probably about using these about 20 minutes per treatment, 10 hours a day. I get about 3 weeks or so out of a single 9-volt battery. And those aren't rechargeable. That's just a standard alkaline battery. If you're doing an awful lot of vagus nerve stimulation on yourself, you may get less time than that, but they should last quite a while. So the expectation should be for you to get pretty good longevity out of standard alkaline batteries. Okay, so always check that light to make sure it's on. If you don't have a green light there when you turn it on, you probably need to change the battery. And now we need to talk about, once you've made sure everything is working properly, how do you find points with this device? So this device is calibrated to find myofascial trigger points, motor points, and acupuncture points, all of which are exactly the same electrically. They all conduct electricity very well. Your skin is not a good conductor of electricity, but those particular areas of your body do conduct electricity well. So this is calibrated to find those points. You do need to, as we talked about before, work on setting the skin type properly, because some people are going to have skin that's more or less conductive. But once you have that set properly, it's actually not particularly difficult. It is going to take you a little bit of practice, and there are some little hints I can give you guys that'll make this journey a lot easier for you. So I'm going to find a protocol on here that's got some relatively easy to find points, and we'll post those up and I'll find them for you. Before I do that, I want to take just a minute and address this idea of acupuncture points. So whether you believe in acupuncture or not, you could be a physical therapist or occupational therapist or whatever and have no training in oriental medicine. But the reality of using microcurrent is this. Microcurrent is any current that's below a milliamp. So it's millions of amps. It's a teeny, teeny, tiny amount of electricity. And it's very difficult to get that to pass through the barrier of the skin, because the skin is not very conductive. So if you want to maximize your outcomes, the best thing you can do is do your stimulation over areas of the skin that are highly conductive to electricity. So that allows electricity to pass the barrier of the skin and get in the tissue below. It gets into the fascia, it treats the nerves, it relaxes the muscles. But if you don't do that, it's difficult to pass that current through the skin. So we have an acupuncture doll here. You know, there's a whole bunch of lines here, so you can see all of them. And each of these lines in the world of acupuncture is considered to be a meridian. Each of the meridian is an energy line. Some are male, some are female. So you'll see the designation of the Dolphin Neurostim, the yin and the yang symbol. The yin symbol is the dark side, so that's the female side. So that's actually represented as the parasympathetic nervous system, which is your rest and digest functions. So anytime you want things to relax and heal, you're generally going to use the parasympathetic nervous system. And then on the yang side, that's the bright side. Anytime you are trying to get things done, like release a frozen shoulder or get pressure off of nerves or do some specific thing with a joint, the male points are a little better for that. So how do we know which is which? Well, the female points are the ones that are on the soft parts of the body. So that's the front of the body, the insides of the arms, insides of the legs. Those are all female points. Those are all female meridians. And each of those meridians is named after an organ system that's vital for life. Your lung, your heart, your liver, your kidneys, your spleen. They're the things that if you take them out right now or you damage them, you can be dead in minutes. Now, those are all ascending energy. So that's all your energy that comes up. And those are the points you want to treat when you're trying to heal or relax something. Now, the male points are on the hard parts of your body. So that's on the outside of your arms, outside of your legs, and on your back. And those organs are things like your stomach, your small intestines, your large intestines, your bladder. In the words of one of the textbooks I've seen, the male points are hollow, like a man. They are hollow, superficial. They tend to fill up and empty. Oh, and you can live without them. So you could take any one of those organs out, stitch it all back together. It works just fine. So that's kind of the importance of the male side of things in the world of acupuncture. The female meridians are much more important. The male meridians take a back seat, and they tend to just kind of like get things moving again. All right. So we have all these. Each meridian is named after an organ system. Each of the points is numbered. In the world of acupuncture, in Chinese medicine, each has a name, like the meeting of three rivers or the sea of tranquility or something fancy like that. We just give them like numbered points. So there's kidney 1, kidney 2, bladder 1, bladder 2. And you can see those on any acupuncture point or point chart or doll. That's not a problem. So with all that being said, when you look at the book that comes with your Dolphin Neurostim, it's going to have a series of points listed. So here's one for muscle strain, upper limbs, and arms. So let's see what we've got here. We've got a couple points here on the, we're going to look for this point right here, large intestine 4. So large intestines, hollow, superficial, fills up and empties, and you can live without it. So that's a male point. And that's on a hard part of the body. That's located on the outside of the arm. And then we're going to actually come up to the elbow. We're going to look for large intestine 11 right here, which is a great homeostatic acupuncture point. Also a male point. So I'm going to show you guys how to use the Dolphin Neurostim to locate these particular points. And then we're going to treat them. So large intestine 4. Large intestine 4 is known as Hoku in acupuncture. It is the great eliminator. That's what it's called. And it is really good for eliminating things. It is a distal acupuncture point that treats a proximal part of the body. So large intestine 4 actually treats the anterior neck and face. So if you have a toothache or a headache or a sinus infection or your tonsils are bothering you, it doesn't really matter what the problem is. This is not a problem-specific point. This is an area-specific point. So if we treat this point, it treats this area of the body. It's a point that you would probably avoid during pregnancy unless you're trying to induce labor, but it is a very, very useful point. People always cite it like, hey, if you got a headache, kind of rub between your index finger and your thumb. It'll make your headache go away, which is true, but that only works well for tension headaches. If you try to use it on migraine headaches, you're going to find that in about 50% of the cases, it will make the headache go away, but you actually get a rebound headache that's worse than the initial headache. So we have other points for migraine headaches. I would avoid large intestine 4 for migraine headaches. Okay, so how do we find this point? Well, here's my index finger. Here's my thumb. There's a little web of skin right here. The point is not in this loose part of the skin. It's actually up in the meat right here. So if I take my hand and I pinch, you're going to see where I slammed my finger with a hammer right here. If you pinch your thumb up against your index finger, right there at the top of the mountain is going to be your acupuncture point. So let me grab a pen here and mark that so that we can find it. If you take your finger and push on this point, it is quite tender, so you can actually push on it to see how tender it is. And this should be large intestine 4 if my point location is accurate. So I'm going to take one of the Dolphin Neurostims. I'm going to use the roller switch right here. I'm going to turn it on. That one has a bad battery. We're going to turn this one on. Check and make sure we have a nice green light here, which tells me my battery is good. I'm going to make sure that I have my thumb on this metal plate. Very, very important. Now, if I'm treating myself, all I have to do is touch this metal plate. Like, that's all that's needed. But if I'm treating someone else, I have to have my thumb on this metal plate, and I have to have some skin contact with my patient, meaning if I were treating this shoulder right here, I would need to touch this metal plate and put my hand on the patient so that I've got a circuit here. Electricity goes into the point, circles back up through my hand, and in through this metal plate right here. So it actually completes the electrical circuit. If you don't complete the circuit, you're just doing acupressure, meaning if you take your thumb off this metal plate and just start poking around, even if you're pushing the button down, you're not doing anything. You're doing acupressure, but you could use a toothpick for that. So you need to make sure you got your thumb on the metal plate and you have skin-to-skin contact with your patient. Now, does it have to be the hand you're using for treatment? Absolutely not. Like, I could treat a point on top of the head like this, making sure that I have my thumb on the metal plate, and then I could hold the patient's hand, and that's all I need to complete the circuit. But I must have skin-to-skin contact. I can't touch their shirt. That doesn't work. You have to actually have skin-to-skin contact. Now, there are some exceptions to that where we can use some different electrodes, and we'll get to that in a few minutes, but this is like basic how to treat points. All right. So turn the Dolphin Neurostim on, make sure I got a green light because the battery's good. I'm going to break my own rules here so you guys can watch along with me as I do this. I'm going to flip this around and put my fingers on the metal plate instead of my thumb, but you should actually have your thumb on the metal plate. So as I turn this over, I'm going to use the heel of my hand as a fulcrum. I'm going to pull this across the skin on my hand, and you will hear the tone start to change. And you might see the light flicker a little bit. And when I get over the point, the light goes out. So there are two things that are going to tell you you're on your acupuncture point. One is you get a really high pitch out of the Dolphin Neurostim, and the other thing is the light goes off. Once you see that, so you can't push this button until you find the point. So if you just push this button, it's going to start beeping and blinking. And at this point, I can't find any acupuncture points. But if I find my point first, and then to press the button, you're going to hear it start to beep, and now you're actually doing a treatment. So because this is me, I only have to touch the metal plate. If it were a patient, I have to have skin-to-skin contact like this. So now I'm actually treating the point. So what you want to do is you want to count out about 30 beeps. That's kind of the minimum of what you need. So our protocols are designed so that therapists who work in hospital settings and private clinical settings can get these protocols done in about 15 minutes. Because in the world of insurance, at least in the US, you have about 4 15-minute segments you can bill on any one patient. Somebody decided that an hour of therapy is what you guys need. So that's what insurance companies will give you. So we have to do this pretty quickly. If you count out about 30 beeps, that's usually enough for most acupuncture points. You can certainly apply this for a longer period of time if you have more time, but that's sort of the minimum of what you're shooting for. So that should get you in a pretty good window of time and allow you to do your manual therapy and your stretching and your neuromuscular reeducation or whatever else it is you have to do. Okay, so that's how we find the points. So now we're going to find one more point just to make sure you guys got it. So I'm going to pull this down a little bit. We're going to go to the end of the elbow crease right here. So this is our point we were looking for here. That is large intestine 11 right here. And you'll notice that it is marked as being a negative polarity right here. So we're going to make sure our Dolphin Neurostim is set on the negative polarity. So I've got it set there. And I'm going to go to the end of this crease. So right at the end of the crease at the elbow bend is large intestine 11. Right about there. And now I'm going to take the Dolphin Neurostim. I'm going to turn it on, make sure I got a green light so I know the battery is good. So there's my green light. I'm going to pull this across my skin, making sure I touch the metal plate. And lo and behold, when I get to the point, I get a really high pitch and the light goes out. So you can see it if I turn it around, like there we go. And then I'm going to push the button down. Now, what you'll notice is the light is flashing. You guys see the light flashing there? But if I change the intensity of the stimulation and then go back to the same point,
Hi.
you'll hear the Dolphin Neurostim beeping, but there's no flashing. And there's a really, really, really important lesson here. So large intestine 11 is a great acupuncture point for homeostasis. I used to use it a lot in my kids when they had fevers when they were younger. That's a great point for that. It's a good point for just balancing the body out. But here's the deal with the light. So there are 2 times when you want to look at the light on the Dolphin Neurostim. That's when you first turn the Dolphin Neurostim on to check the battery. And the other time is to make sure you've actually found an acupuncture point. And anytime outside of that, you are just going to get confused. Okay, so that light is meant to do 2 things. It's meant to tell you you found the acupuncture point, and it's meant to tell you that the battery is good or not good on the Dolphin Neurostim. When you're doing a treatment, if you're pushing this button down, if it flashes, that's great. If it doesn't flash, that's great too. It's going to depend on the conductivity of the skin. It's going to depend on the intensity of the Dolphin Neurostim. It's going to depend on how well you may have connected any wires for some external thing like vagus nerve stimulation or something else like that. So again, only look at the light for those 2 purposes. Anything other than that is just going to bother you. And it's going to lead you down a rabbit hole that's going to amount to nothing. We spent years investigating this stuff. Don't waste your time. Okay, so that's how you find acupuncture points with this device and motor points and trigger points. Even if you don't know what you're doing with this device, I have patients who have these devices who live in rural areas. They drive in a couple of hours to see me. They have these at home for home use. They don't know anything about acupuncture points, but what they know is if they take this device and their neck hurts, if they set it on the negative polarity and pull this across their neck and listen for a high pitch and push that button down and hold it, they can get themselves pain relief because they can treat the myofascial trigger points in the area. So this will inactivate myofascial trigger points, but we do recommend that you guys use the protocols that we've given you in the books with this device, because these are going to help you out a lot. These are going to help you get more to the root of the problem than just treat the symptoms. All right, so that is kind of how you find points, the basics for treating points. Now we need to talk about what to do if you're going to treat a scar. So if you're going to treat a scar with a Dolphin Neurostim, you need not 1, but 2 Dolphin Neurostims. So there's a really important reason for that. If you bought a scar kit, I'm going to explain to you why you need that. Let me get us a sip of water here. So in the world of treating scars, we do scars better than almost anybody else. I've been a therapist for about 30 years. I've taken a lot of courses in how to treat scars. I've treated everything from open heart surgery scars to brain surgery scars to C-section scars and mastectomy scars and knee replacement scars. All those scars respond very well to therapy with the Dolphin Neurostim, as do stab wounds and gunshot scars. So there's a lot of things you can do with this. You can even treat deep abdominal adhesions with this, but there are some things you need to know. So why would you treat a scar in the first place? Well, number 1, scars can be painful. So nerves can get bound up in the scar tissue itself. It puts pressure on the nerves, it sensitizes them, and it makes them painful. So if you can release that scar tissue, it's going to feel much better. You also might treat a scar because you have had like a surgery on your knee and you have a lot of swelling down in your leg because the lymph can't move back up past that scar tissue. So you may actually treat the scar to release the tissue in the area. So if your part of your background's in lymphatics, I always recommend doing Dolphin Neurostim work first on any scars that are in the area, because that makes your lymphatic drainage much, much easier. You know, if you do it the other way around, you're just fighting against yourself. So use the easier tool first Then use your really cool skills after that. But this is the Dolphin Neurostim is designed to make whatever you do easier. So if you do massage work, do some Dolphin Neurostim first. If you treat scars manually, do some Dolphin Neurostim first. If you do manual lymphatic drainage, do this first. Not because it's better, but because it sets you up to do those things at a much easier pace. It becomes much easier for you guys. All right. So what other reasons might we treat a scar? Well, scars can actually block energy in acupuncture. So if you have an abdominal scar, this is all your ascending female energy. If you block this, it's going to cause you all kind of problems. So you need to release those scars. Scars can wind up your sympathetic nervous system. So an old scar can make new pain worse because of how it electrically affects the body. So sometimes we have to inactivate a scar. And scars are something that can limit range of motion. So you can have somebody who's had a knee replacement who can't bend their knee because of scar tissue. No fault to the surgeon. It's just how people heal. So sometimes you have to treat that kind of scar tissue for adhesions, but sometimes you'll see scar tissue that affects things from a distance. Like we've seen people who've had like a hip replacement scar who can't raise their shoulder. And it's not because they have a bad shoulder, it's because it's pulling all through the connective tissue, the fascia in this area. So your body's covered by this body stocking of connective tissue called fascia. And if you put cuts in it anywhere, it can pull throughout the rest of the body stocking. So if you have a hip replacement scar, it can actually affect your shoulder, and you could have a frozen shoulder, but from a scar in your hip. So a lot of reasons to treat scars. So we're going to go over how to treat a scar. I don't have any major scars that haven't been treated. So we're going to pretend like we have a patient who has an open heart surgery scar. And having treated those kind of scars, I can tell you that open heart surgery patients tend to have a lot of pain back here. They tend to have a lot of upper back and neck pain, and it just doesn't go away. And you can massage the area, you can inject the area, you could do myofascial release to the area, you can stick acupuncture needles in. There's all kinds of stuff you can do to this area, but the pain doesn't go away until you release what's going on in the front, because when you get a scar up here, it pulls on everything, and as you pull everything in like this, it strains all this area back here. So if you don't release this first, you have a hard time getting rid of this pain back in here. So we're going to go over how to do that in just a second here. So first we need a patient. So we're going to draw a very unhappy patient on our little whiteboard right here. So we're going to pretend like this guy up here has had open heart surgery. And you can see that he has a very frowny face because he's very unhappy about his surgery. He's alive, but his upper back and neck hurt a lot. So here's our patient. And here is his scar right here. So this is our open heart surgery scar. So we have to figure out what to do with this tissue. Scar tissue is problematic to treat, and I'll tell you why it's problematic. Because normal body tissue, everything else around this patient has a negative polarity. But for whatever reason, scar tissue has a positive polarity. So it has a different electrical charge. So if you were trying to repolarize this tissue and change the polarity of this to be like this tissue, the problem you're going to run into is that most body tissue, most scar tissue is very unconductive to electricity. So if you tried to use a standard TENS unit and you did something like stuck like a TENS unit pad over it, thinking like, hey, I can use that to electrically change it. The problem you run into is that because this tissue is non-conductive, electricity is like water. It takes a path of least resistance. So if you try to put electrons into it with a pad, it's just going to go around the scar. It doesn't actually go to the tissue itself. And if you want to change this scar, you have to change the electrical polarity of it. How do we do that? Well, we have to have two Dolphin Neurostims, and we have to push electricity into one side of the scar and pull it through the scar. And the only way we can do that is by using direct current electricity. So with alternating current, the current flips back and forth all the time. With direct current electricity, we can actually choose to push it in one side and pull it towards the other side. your body runs on direct current. If you want to modulate the body, it's much better to use direct current to do that. So using one Dolphin Neurostim is quite a bit less effective than using two Dolphin Neurostims because we have two separate sources of electricity here we can pull and push with. So what I'm going to do is I'm going to take one Dolphin Neurostim. I'm going to look at the polarity switch and set it on the negative polarity here. So that's the minus symbol. And I'm going to take the other one and I'm going to shift it over to the biphasic setting, which is this plus minus setting right here. So now I'm going to play a game of ping pong with electrons. So how does that work? Well, if I have two Dolphin Neurostims, I'm going to use two different markers here. And when you use a negative polarity on one side of the scar, and when we use a biphasic current on the other side of the scar like this, so we have our two different polarities here. Let's pull this up so you guys can see it a little bit better here. Go. So I'm going to go on either side of the scar. So I'm not actually going to go on the scar tissue itself because it's not very conductive to electricity. So what I want to do is make this more conductive. I want this tissue to be like all the rest of the tissue on the body. So I'm going to put one Dolphin Neurostim on one side of the scar and one on the other side of the scar like this. And I'm going to hold them there. And I'm going to count out 10 beeps. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So once I've done that, and one of them is actually going to be on the biphasic settings, so it's going to sound a little differently. So you're going to get this sound. One's going to be a regular beep. One is going to be a loping sound. And then after I do that, I'm going to move down about a quarter of an inch on either side of the scar. And I'm going to count 10 beeps here, 10 beeps here, and I'm going to work my way all the way down through the entire length of the scar. Once I get to the bottom of the scar, what I typically do is reverse the Dolphin Neurostims in my hands. I could change the polarity with my hands if I wanted to, but that's just more work. And then I'm going to work my way back up through the scar. 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps, 10 beeps. So that's 2 passes down and up. And now I'm going to switch them one more time. You don't have to switch them. This is just what I do. And go all the way down again. 10 beeps each time. So what we have is we have 3 passes at 10 beeps each. So what we're doing is we're playing ping pong with electrons. We're actually bouncing electrons back and forth to this tissue. And in the course of doing that, we're changing the polarity of this tissue from a positive polarity to a negative polarity. So who cares? Like, why does it matter that you do that? Well, here's what happens when you do that. One of our instructors was able to get together with a doctor who is one of the high-end ultrasound instructors in the US. He writes books on diagnostic ultrasound. And what they found is in treating scars, actually watching the scar on live ultrasound, you're looking at the measure you're looking at is the cicatrix or cicatrix. I'm not sure which pronunciation is preferred, but the cicatrix or cicatrix gray mean density. So basically the density of the scar itself. And so what you're going to get with each scar treatment, so properly done, if you do this well, a scar is going to have something like a 24% reduction in the overall density of the scar. So the translation of that is when you treat a scar, it goes from being very inflexible to about 24% more flexible. So if you do the math, you're looking at 4 to 5 treatments for most scars to release them. If it's surgical scars, it's going to take you 4 or 5 really solid treatments to release that scar tissue to get it back to being more like normal tissue. And once you have that, range of motion should be better, pain should be a lot less. What I shoot for the first time I treat a patient, if they have a painful scar, I'm looking for about a 50% reduction in the overall density of the scar. And if I don't get that, usually I'm missing something. So this is a basic scar release. Now, if you look at the literature that comes with your Dolphin Neurostim, it's going to tell you after you do this, you need to plug the ends of the scar. So that's going to tell you to take a Dolphin Neurostim and put it either end of the scar like this. Let's grab our little markers here. You're going to hold them right here. So I'm going to give you a piece of advice. I teach advanced scar tissue courses. I do this all the time. I don't think it's enough to hold it either end of the scar. I think you should actually work your way through the scar, moving quarter of an inch increments, 10 beeps each, and do 3 passes again. So again, I'm going to say 3 passes at 10 beeps each on the scar. And in doing that, you're driving current directly through the scar tissue. So why didn't we do this to begin with? Well, we've got tissue that's not really conductive to electricity, so we need to pass electrons back and forth through it to repolarize it first. But once we have that, we can push more current through there and we can repolarize the tissue and usually get it to release. Now, I teach a whole 2-day course on scar release. We go into all kinds of acupuncture points and advanced circuits and what scars do to your health and how it affects your emotions and which scars to look for and things like that. So we do live courses. This is certainly not the end of scar treatment, but if you learn this very basic release, this is better than 99% of most of the classes I've taken over the course of my career, using manual therapy, using scraping techniques, and using ultrasound and using manual therapy techniques. I've seen scar injection with procaine, which electrically repolarizes the tissue because of the charge of the procaine. That's almost as effective as this, but you run into problems when you get into deep abdominal adhesions. So if you have one abdominal surgery, you have an 80 to 85% chance of getting abdominal adhesions. That's scar tissue that grows beyond the boundaries of the incision. It doesn't matter if they cut you open or they stuck a hole in you and sucked your gallbladder out through a straw. As soon as you stick anything down in here, your body flips out. It believes that your entrails are going to become your extrails and starts laying down scar tissue. That tends to wrap around organs and pull on things. It creates postural distortions. It can cause all kind of back problems. And if you have somebody pull forward like this, they're going to have forward head posture and they're going to have posterior neck pain as well. So if you have somebody who has neck pain and upper back pain, oftentimes you have to release abdominal surgery scars. And these could be years old. These could be 20, 30, 40 years old and still be affecting somebody's posture, or it could be a very new scar. So that then begs the question, how soon can you start treating a scar? You can start treating immediately after somebody has surgery. You can actually get on the outsides of the dressing and bounce a current back and forth through there because low frequency direct current increases protein synthesis, it increases cellular membrane transport, it increases high frequency vagal tone, it increases heart rate variability, and it also increases ATP production by 400 or 500%. So there's a lot of cool things that happen when you use microcurrent as a healing device. But once you already have a scar, it can also affect the flexibility of the scar to begin with. And here's the cool thing. If I release a scar by 24% today and don't do another treatment for 6 months, whatever progress I've made, I don't lose that. So I could do 4 treatments like once a week over the course of 4 weeks, or I could do 4 treatments once a month over the course of 4 months, and in the end, get the same outcome. Because whatever amount you change that scar, it tends to stick. All right, so that's the very basics of how to release scars. Now we need to look at what to do if we're going to do vagus nerve stimulation. So if you have a vagus nerve stimulation kit, I suggest you pull out the pieces to it. I'm going to explain to you what you have at your disposal and how to use it. Let me double check this here real quick. My son was in a wrestling tournament last night and may or may not have had a concussion. So I've been treating him on and off through the evening. So I'm at the office and he's at home and he's actually using this at home right now, doing vagus nerve stimulation. So we're going to check and make sure he's okay. All right. Everything looks good there. All right, so pull out your Dolphin Neurostim kits with your vagus nerve stimulation. You should have, if you're doing vagus nerve stimulation, you need one Dolphin Neurostim. What is the vagus nerve and why should you treat it? The vagus nerve is the longest nerve in the body. It is considered to be, it's called a wandering nerve. And it is the information superhighway between the brain and the gut. More information goes from your gut to your brain along the vagus nerve than goes from your brain to your gut. So the vagus nerve is often called the second brain. It has a very strong influence on the sympathetic and parasympathetic nervous systems. So it's a big influence on the autonomic nervous system. It has such a strong effect that years and years ago, there's a doctor that we know who trained in Great Britain. And for whatever reason, back in the day, they actually used to cut people's vagus nerve during certain medical procedures. And what they found is if you sever your vagus nerve, you will never, ever, 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 ever get Parkinson's disease. So the vagus nerve is highly tied into some of these autoimmune problems, and you need to learn how to modulate your vagus nerve. So I'm going to teach you a way to do vagus nerve modulation using a microcurrent device. So the vagus nerve will affect the balance between your sympathetic and parasympathetic nervous system. So your sympathetic nervous system is your fight or flight response. That engages when you are under stress. So that is what prepares you to fight something off. That is the yang side of the yin and yang symbol. The parasympathetic side of the nervous system is what they call rest and digest. That is the yin side of things. You need to spend 70% of your day on the parasympathetic nervous system side. If you don't, you're kind of screwed, which means if you aren't sleeping well, if you're eating bad foods, if you're under huge amounts of stress, and you don't spend 70% of your day on this parasympathetic side of your nervous system, it affects your overall health. And there's like a 95 to 98% chance that everybody on this little tutorial will die of a stress-related disease. Let me say that again. Most of you guys are going to die of a stress-related disease. You're not going to get hit by an airplane. You're not going to get mauled by a bear. You're not going to die in a car accident. You are probably going to die of a stress-related disease, which is going to be something like heart disease, strokes, some kind of autoimmune stuff that's flared up by stress. So it's really, really important to learn how to modulate the stress response of your body. Now, there are things that you guys control that I can't control. You guys can control the food you eat. So like if you're eating a lot of sugar and a lot of gluten and things like that, those tend to be inflammatory. Those are not great, but I can't control those. What I can do is teach you guys how to use this device to neuromodulate your nervous system. So I can give you more of the parasympathetic and less of the sympathetic nervous system, and we can balance those two things out. So that's what I'm going to teach you guys how to do. All right. How do we do that? Well, you need a Dolphin Neurostim. You need to check it, make sure you got a good green light, because that tells us that, of course, the battery is good. You're going to look in your kit. There is going to be a wire in your kit. And it doesn't matter if I wear a white shirt or black shirt. There's always one that doesn't do well. But this wire will have a male connector on it and a cup on the end of it. If you look at the end of that cup, you will see a shiny metal plate. So that shiny metal plate has got to touch up against the tip of the Dolphin Neurostims. We're going to put these two together and make sure we got a really good fit right here. Now, if I really want to make sure that I've got this right, if I turn the Dolphin Neurostim on and take this tip and I touch it to here, look what happens. Like, see how the light goes out? That tells me that I've got a good connection. I'm completing the circuit. So that's a good thing. So that means I've got a good snug fit there. The next thing I'm going to need one of these white cords. And this typically comes in the bag that has a lot of your electrodes in it. So there's a bag that looks like this. It's got a little dolphin on it. And there should be a white cord in there. The white cord will typically have what looks like a male connector and a female connector. But if you look carefully, you will see that there's a male connector inside of here. So this is designed so that people don't stick these in electrical sockets and electrocute themselves on both ends. but both ends of these are exactly the same. So it doesn't really matter which end of this you use. So also in your bag, you are going to find some electrodes that look like this. They are an oval shape like this. And you will notice that it is cut to fit this part of the Dolphin Neurostim. Now, before you put it on there, I really recommend that you get yourself a bag of alcohol wipes or get a jar and put some balls of cotton in there or some makeup remover, those little pads. Put them down in there and pour alcohol over it. And then you can use those to clean this really well because these are expensive. And these will never touch a patient's skin. So as long as this metal plate is clean, you guys can put this on here and it's going to stick really, really well. But as soon as you get oil from your skin on this plate and start trying to stick things to it, once the oil gets on the adhesive here, it affects the adhesive ability of this. So I really recommend that you clean these really, really well with an alcohol wipe. So I'm going to wipe this down really well here. I'm going to stick my little white electrode on here, and you can see that it covers it quite well. Now, I can use either end of this white thing, and you notice that this electrode has a white tail, and this is a white cord, so these are color coordinated, so that's kind of nice. So I'm going to connect these together, and so now I have at the end like two little connectors like this. So now if I wanted to check these, I can touch these together and you can see the light goes out and the pitch goes up. So that tells me that I've got a really good connection there. And if you're taking a million notes, let me save you a minute here. You guys are going to get a code in a couple of days. You can come back and watch this tutorial whenever you want. So if you feel like you've missed something, you can watch this 5 or 6 or 8 times or whatever, and it's free. You can actually come back and take this tutorial over again. So if you miss something, sign up for it again and come back and take it over again. And if there are questions you need answered, you guys can do that. All right. So now I've got these things connected. So what do I put on the ends here? Well, on the white end of this, you will notice that there are some electrodes that have a white tail on it. Again, color coordinated. So you want to open this. And remember how I told you that you want to clean this metal plate right here? Well, wherever you put these electrodes, if you clean that area with alcohol, you can use them over and over again. So for example, if I'm using this on me and the card with the Dolphin Neurostim says, hey, I can put this right below my belly button. If I clean that area with an alcohol wipe first, these things will stick for probably 3 or 4 weeks. I can use them over and over again. Now, if I were a therapist, I wouldn't use these on the same, I wouldn't use these on different patients, but I might use the same electrode over and over again on the same patient because it is, you sterilize the area and you're using this electrode and it sticks just fine. Okay, so we have these electrodes. You're going to connect the white cable to the white tail. You will notice from the literature that comes to the Dolphin Neurostim, it tells you that you can put this either on your wrist like this, or you can put it below your belly button like this. So for me, what works best is putting it about 4 fingers below my belly button. So I'm going to do that. So I'm going to stick this down below my belly button. Theoretically, I would have cleaned that area well with alcohol so there's no oil on it. And now I'm left with one other cable. In your equipment there, you have some ear clips. You have some that are white and you have some that are black. And you will notice that the black ones have a little metal plate on them, while the white ones have a black sort of dome on them. So we actually call these dome electrodes. So why do we have little clips in here? Well, these are ear clips. So in the world of the vagus nerve, the closest you're ever going to get to the vagus nerve without sticking your hand in somebody's brain is the ears. There was an MRI study that was done recently, and they were looking for the highest concentration of nerve endings for the vagus nerve. And those are on the inside of the tragus, which is this little flappy thing. So if you push on this little flappy thing to close your ear, that's the tragus. So on the inside of this, on this part right here, is highly correlated with the vagus nerve. And the upper concha of the ear, which is this area right here, is also. So if you push the little flappy thing in and then pull back and make like a hook like this, you end up hooking in what's called the upper concha of the ear right here. You'll notice that when you start playing around with it, whether you use the black electrodes or these white ones, the ear clips, if you try to get the inside of the tragus, these tend to slip off quite a bit. But if you go to the upper concha of the ear and use these dome electrodes, so we had these specially made to fit up in here. So these fit like very, very well right up in here, and you get really good skin contact. Now, this is conductive rubber, so it's rubber that has carbon infused in it. You need to moisten both of these before you put them on your ear. So you want to have something that's conductive. You could use water. You could use alcohol. I like to use something called 1020, which is, you can barely read it anymore. Let's see here. Yeah, you can't even read anymore. But anyway, this is an EEG paste. You can get it on Amazon. You cannot get it on the Dolphin Neurostim site. So don't call them and ask them for it, because they'll call me and fuss at me. But it is a thick paste like this. You're going to take just a teeny tiny little dab of it, and you're going to put it on either the metal part of your black electrodes or on the black part of the dome electrodes. And again, color coordinated, black tail, black cable. So you're going to put these together like this. You're going to put this generally on your left ear. So what we know is the left ear is really good at bringing things down, and the right ear is really good at bringing things up. Most of what you're trying to do is bring things down. So you're trying to calm anxiety. You're trying to bring down systemic inflammatory responses. So doing this properly will reduce the chances of basically rogue inflammatory cells running around your body. Pro-inflammatory cytokines is what they're called. So we're going to put this on my left ear. I have an electrode below my belly button like this, or I could put it on my left wrist. There are 3 acupuncture points right here, and then there's the golden triangle in acupuncture, and those are actually used for bringing your system down and treating anxiety. So we could put one here. You're going to have to play with it to figure out what works best for you. Everybody's vagus nerve is a little different. So once I have all this set up, I'm going to turn this on. And when I turn it on, I probably won't see a light here because I have a really tight connection here. I want to use the negative setting. And then I'm going to turn this over and see this little button right here. Like I could hold this button down the entire time, and it's going to beep and drive me crazy, and I have to hold this down. Or I can push this little button right here, and you'll notice it's perfectly silent. If I roll this over, you'll see that the light is flashing. So I can turn it up and it's flashing. I can turn it down and it's not flashing. But this is on a time sequence. So now I'm doing stimulation, like I'm stimulating acupuncture points in my ear, I'm stimulating the vagus nerve, but I'm not having to hold a button down. So I can read a book, I can wash dishes, I can do whatever. And this will continue to run for 14 to 15 minutes. So it's set on a time cycle. So at the end of that cycle, it reverts back to what we call the search stage. So you're going to get a really high pitch out of the device. And at that point, the treatment is over. So you can either choose to stop the treatment, you can take everything off, or you can push this button again and initiate another round of treatment. On our older devices, you could push that button. It would run all night long or all day long. The problem with that is people put vagus nerve stimulation on and they get really sleepy. So they tend to fall asleep, and then they do vagus nerve stimulation for like 6 or 8 hours. And then they're really, really groggy afterwards. So you need to do not quite so much. So how much of this should I do? I should start with about 5 minutes the first time I do this and see how I feel. You know, if I feel really, really lethargic, I need to do less. If I don't feel anything, I need to add 5 minutes. So we typically add about 5 minutes a day until we hit about 20 to 30 minutes. That's usually what most people need. If, however, you are an elite athlete and you are training every day and you're trying to modulate your heart rate variability and modulate your high frequency vagal tone and modulate your exercise tolerance, your VO2 max, then you might require more than that. If you have a chronic inflammatory condition of some kind, or you have an autoimmune disorder of some kind, you might require more than that. I know that when I had active COVID back during the Delta variant, my oxygen saturation dropped to about 90. I really didn't feel good. And then one day I felt way worse and I checked my oxygen saturation. It was 80. And I felt like I was going to have to go to the hospital. So I actually used the Dolphin Neurostim for about 2 hours straight through. And after that 2 hours, my oxygen saturation was back up to about 90, which is not great, but it kept me out of the hospital. So very, very useful tool. It is used to help people go to sleep. It is used for anxiety. It is used to reduce pro-inflammatory cytokines if you're having a flare-up of some kind of autoimmune disorder. It is used when you're sick to boost your immune system. It is used for elite athletes who are trying to keep themselves from going into overtraining syndrome by too much heart rate by not enough heart rate variability. So there are a lot of things you can do with this that are really, really positive. And over time, it does modulate your nervous system. Like if you track things like HRV, which is your heart rate variability, and I'm not going to get into a tutorial on that right now, but your Aura rings, you'll do that. Your Apple Watches will do that. Your sleep number beds will do that. Your HRV, look into that if you don't know what it is. The higher that number is, the healthier you are. This will raise your heart rate variability. Like this will, sitting on your couch, basically make you a healthier individual if you use it periodically to modulate your nervous system. It doesn't mean you don't need to eliminate stress. It doesn't mean you don't need to get rid of bad diets and bad relationships and, fix the things that are wrong in your life, but this will help you out. All right. So that's all the basics of vagus nerve stimulation. There is a piece that comes with your device. So before we do that, we're going to talk about this. You can take this and put it on your right ear. If you do that, you need to switch this to the positive polarity, and that's used for bringing things up. If you need to bring things up, that's going to be generally people who are really, really adrenally suppressed. That's going to be people who have things like tick-borne illnesses, like let's see, Lyme disease. Like you're going to need to use this to bring things up because you're going to be so pushed down. And you might do 5 minutes of it. You might need 2 hours of it. But whatever you choose to do, I generally recommend don't do the right ear on positive in the evening because it tends to keep people up at night. So if you're going to do that, I would experiment with it in the morning first and then see how you do with it. So generally right ear in the morning on positive, left ear in the afternoon or evening on negative. If you're going to do the right ear, you could do the right wrist, or you could do it on the tummy. And so that's reflected in here. And if you want to know like how to put this on your ear, on the other side of that card, there are some little charts there that show you how to do that. All right. There is also included with your Dolphin Neurostim what we call a splitter wire. It is, or a Y wire. It looks like this. It has 2 male connectors on one end, and a female connector on the other. So I can actually take my Dolphin Neurostim, disconnect the ear clip, and pull this loose from the black cable. Connect the splitter wire on here like this. And now I have 2 connectors on this end. So now I can put 2 ear clips on here like this. And I can go to either ear like this. Again, the upper concha of the ear. This is the flappy thing. This is the tragus. If you pull up and hook right here, that's the upper concha of the ear. So put my conductive medium on here, some 1020 paste or some water or alcohol, and go like this. So I have both of these on here. I have the white wire connected below my belly button. I can turn this on, and I can flip this down to the biphasic setting like this plus minus symbol right here. And then I can push this little button, and now I'm treating both sides of the vagus nerve. So I'm treating the side that goes down. I'm treating the side that goes up. Most people do very well with this. However, there are some people who find this makes them a little bit nauseous. If you're one of those people, I suggest either treating the left ear or the right ear. Okay, that's everything with the vagus nerve. Now we need to look at what The do's and don'ts are of the Dolphin Neurostim. So here are your contraindications for this device. Um, so here are the things that are okay: plates, screws, artificial joints, artificial knees, artificial shoulders, dorsal column spine stimulators, baclofen pumps, insulin pumps, like all those things, staples, Harrington rods in your spine, all that stuff is fine. Not a problem. There's no issue with this. Pacemakers and defibrillators, you should talk with whoever the doctor is who put them in the patient. If you want to use these on one of those patients, you should take this that comes with your Dolphin Neurostim and open it. There's a page in there, it's probably page 2 or 3, and it has a description of electrical performance. It has all the electrical parameters, the Dolphin Neurostim. You can send this to them and say, like, hey, I want to treat your patient. This is what I want to use. And they'll probably say something like, fine, but don't treat over the device itself. So leave the heart alone. But again, always defer to the physician who put it in. If you have a patient who has a history of epilepsy or seizures, do not treat on top of the head. Like, even with needles, you're not supposed to treat right here. There are acupuncture points that stop seizures, and I've seen it work. There's a point on the bottom of the foot called kidney 1 right here. It works great for stopping seizures, but don't treat on top of the head. Also, if you're pregnant, don't treat on top of the head. This point pushes energy down, so we want the energy to stay in and not get pushed out. So don't treat on top of the head. Don't treat on top of the shoulders. This pushes energy down. Don't want to do that. Don't treat large intestine 4 between your index finger and your thumb. This is the great eliminator, okay? So if you are 9 months pregnant and you're trying to induce labor, like, this is a point you would use. Other than that, leave it alone. If you're pregnant, avoid treating spleen 6 on the inside of the ankle, SP6. That is also used to induce labor. So there are definitely some points to stay away from. Do not treat over a gravid uterus. Don't treat over the tummy. There are a lot of doctors who will prescribe TENS units to put on patients' backs who are pregnant, but don't treat over a pregnant belly. That's considered a big no-no. And if you're going to treat somebody who's pregnant at all, I do recommend consulting with a doctor who is over the case to make sure you're not doing anything that's going to interfere with the pregnancy. Cancer. It's okay to treat for things like nausea with chemotherapy. There's some great points for morning sickness and nausea and stuff like that that are on the wrist. Those are great. There is a microcurrent system on the market that is designed to shrink tumors. So there's a microcurrent device. This is a microcurrent device that is used to treat glioblastoma, which is brain cancer, a particular kind of brain cancer, and it will shrink those tumors. This device does not have that medical indication. So you can't go to a doctor and say, hey, I'm going to treat your patient's brain cancer. Some people caution against using any kind of electricity around active cancerous tumors because the thought is you don't want to increase abnormal cell growth in an area of already uncontrolled abnormal cell growth. So there's an argument either way with that. Small children and babies, it's fine. Just turn it down. Dogs, cats, horses, not a problem. I've never treated a lizard, so I couldn't tell you there. But dogs, cats, and horses respond well to acupuncture points with microcurrent and disc problems. I would actually treated across the street, my neighbor's dog had some disc issues, and I gave him a Dolphin Neurostim, and they were treating the disc issues, and the dog seems to be walking better now, so it works well for that. Other things, use the rule of pencils. Don't stick this anywhere you wouldn't stick a pencil. Don't jam it up your eye. Don't stick it way up your nose. Don't stick it in your ear hole. Don't jam it down. Like, just keep it away from places you wouldn't stick a sharp object, and you should be good. You're not a problem there. And I believe that is most of the contraindications for the Dolphin Neurostim. The other thing we need to talk about for a minute is something that comes with the Dolphin Neurostim, which is an extension probe. Depending on which kit you got, you probably have something that looks like, let's see here. You probably have something that looks like this. It looks like a ballpoint pen connected by a wire to a cup. You'll notice that cup has a shiny metal plate in it, just like the other one. We're going to connect this to the Dolphin Neurostim like this. I'm going to turn the Dolphin Neurostim on, and I'm going to, oop, that one's got a bad battery. We're going to turn the Dolphin Neurostim on, make sure I got a green light. I'm going to touch this to here, and you'll see that light goes out, so I got a connection. I can use this to treat points on myself. So I can touch this down and push the button and treat acupuncture points or trigger points on my own neck. I can bend this and tape it to a back scratcher and treat points down my back. So it's very useful for that. And you can bend it back once you're done. So it'll go into whatever position you need it to. I do know therapists who do TMJ work. They use this for treating inside the mouth, for treating internal pterygoids. When I worked in women's health, they used to use these, 2 of these and 2 Dolphin Neurostims for treating episiotomy scars, to deal with urinary incontinence and painful intercourse and all kinds of stuff like that. Generally, they're set up for treating externally on the body. If you need to buy more of these, they're about $25. You can pick them up on the website. All right. So that is kind of all the do's and don'ts and all the little things you can buy for the Dolphin Neurostim. So now we need to take a look at any comments you guys have. There are quite a few questions in the chat box. Oh, goodness. So we're going to have to move fast here to get you guys through it. So let me work through these quickly here. For internals, this is from Brittany to everyone. For internal scar tissue, do you still use the acupressure points approach? For instance, where you do not know the exact location of the scar tissue. Okay, so Brittany, let's say you've got abdominal adhesions. Somebody sucked your gallbladder out through a straw. You've got adhesions in here somewhere. What do you do? All right, this is what I recommend. You're going to pretend that there are scars that go across this patient. You're going to pretend like there's one across the bottom, one across the middle, one across the top. And you're going to treat them just like you would. You're going to treat these imaginary lines, which are Dolphin Neurostims. And you're going to pretend like there's a scar that goes up and down like this. And you're going to treat that like this. And that's going to bounce current through that tissue. And it's going to start to repolarize that scar tissue. And if you want to get really, really tricky here, you can take one of these cables like this. Let's see here. And stick it on your Dolphin Neurostim like you're doing vagus nerve stimulation. But what you're going to do is you're going to stick this on your patient's back like this. And now, when I treat these scars, I'm treating back and forth, but I'm also pulling current through the body like this. Okay, so I'm treating actually in 3 dimensions. And this is like one of the basic tricks we teach in our advanced scar workshops. If you treat scar tissue, take that workshop. There's a whole lot more to it. If you were treating a knee replacement scar, so let's say the patient had a scar right through here. You could take this and stick this to the back of the knee like this, and then treat the scar itself and pull current through the knee itself to release that tissue. So that's what you would do. All right. Let's see. Next question. Do you find it effective to set up the device using the vagal kit with the Y wires and put 2 pads on the end and run microcurrent through an area? I'm specifically thinking of using this for disc issues, 1 pad posterior and 1 anterior for paraspinal muscle spasms with pads along the spine. Yes, you can certainly do that. If someone is having breathing issues and you are treating with vagal stimulation, is it better to use left ear and negative setting? It depends. So if the person is having an active asthma attack, you want to use negative polarity because you want to suppress what's going on. If you have somebody who has weak lungs because they've been sick for a long period of time, you probably want to use the positive to bring things up. When doing vagus nerve stimulation, let's see, this one is from, okay, when doing vagus nerve stimulation, do we put the Dolphin on wet, normal, or dry settings? It doesn't matter. And the reason it doesn't matter is the wet, dry, and normal setting on the Dolphin Neurostim is strictly for finding acupuncture points. So it doesn't affect the stimulation in any way whatsoever. It just affects your ability to find the points. When you're doing vagus nerve stimulation, you're not looking for acupuncture points, so don't worry about it. And just clear that off your slate. So you have to become very attuned to the sound when treating yourself, especially face or neck, as you can't see the light. Just listen to the tone. The higher the pitch, the more conductive the point is, and you're good to go. So if you get a really, now I do need to talk about one thing that I skipped over earlier, and this is really, really important. So if you guys are snoozing off a little bit, like pay very close attention to me right now. This is probably the most effective point finder on the market that I've ever seen. However, you can screw this up. Here's how you screw it up. Remember I said use the heel of your hand and use it as a fulcrum and use steady pressure and look for your points. I recommend using small concentric circles. Acupuncture points tend to be pretty small. And if you move too quickly, like if you're moving around like this, you're never going to find the points because you're going to flip right over it. But if you move very slowly and deliberately, you can listen to the tone change. When you get over the point, the light will go out. So go slowly. The other thing is don't stick your patient or yourself with this. Watch this. Okay, so I'm going to look around this area. The light went out. 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 Are all those acupuncture points? No, those aren't acupuncture points. What I've done is I've stuck this down so hard, I've compressed the skin. And because I've compressed the skin, it becomes more conductive to electricity. So if you push really hard, you can talk yourself into thinking you have an acupuncture point, and you will conduct electricity through that piece of skin, but it's not the acupuncture point, and you're going to miss some of the benefits of that. There are specific acupuncture points that stop asthma attacks. There are specific acupuncture points to stop migraine headaches, that treat frozen shoulders, that do release the psoas muscles. Like they're all kind of really cool things you can do. And if you just stick this down really hard on your patient, you will conduct current through the skin because you've compressed it and made it more conductive. But you're not going to be able to get the benefits of those specific acupuncture points because only those points do those specific things. So again, use mild to moderate pressure, use small concentric circles, and you're going to be in a much better place. All right, let's see what else we got here. You can use the extended wand so you can see the light. Yes. Curious if you have treated Dupuytren's contracture. Yes, I have. I have several friends who have it, and you can do a good job on it. And I've even gotten it to release at times with multiple treatments. However, when they go and piss it off because they're chiropractors, they play sports or whatever, it will re-aggravate it. Dupuytren's Viking's disease is actually a skin disorder. Believe it or not, it's a skin problem. So that stuff sticks to the skin underneath. So with needles, they do aponeurosis, and they go and they like jam needles up in there to kind of separate all that out. The Dolphin Neurostim will help release some of that, but if they re-inflame the area, it does tend to come back, and they get those nodules and adhesions again. How usage of the device can help for patients with local epilepsy. There are specific acupuncture points and treatments for epilepsy. Vagus nerve stimulation is really good for calming the system down to avoid epilepsy. However, if you've just had a seizure, don't do vagus nerve stimulation. It's too much. If you're having a seizure, treat kidney 1 on the bottom of the foot. If you just had a seizure, you might treat the parasympathetic calming points on the wrist. But in the prodromal phase of a seizure, avoid doing vagus nerve stimulation because you're stimulating the vagus nerve, which has already been hyperstimulated by the seizure. So you need to give it a little bit of time. Let's see what else we got here. To clarify with scar treatment, it counts as one pass when you go up or down. Yes, one pass. Going down is one pass, going up is one pass, going down is one pass. So 3 passes, 10 beeps apiece. You could go down, up, down, or up, down, up. I don't care how you do it. Just make sure you cover the area well. Oh, what if you have a scar that's like this? What if you have like a burn scar that looks like this? What do you do for that? It's not a linear scar, so you need to treat this as though it were a clock and take your Dolphin Neurostim and go on either side of it like this and work your way around the clock like this. Again, you can do 3 passes this way and then work inside the scar itself. So that's going to be more time consuming. If you're treating burn scars, it takes a lot more time. There's just no way around that. There's just a lot more tissue you have to deal with. What about laparoscopic scars in the abdomen? We went over that. Just treat each of those individually and then pretend like you know where the adhesions are and just make imaginary lines and treat it like a scar and you're good. Basic question from the beginning when I turn mine on pretty loud, how do I make it less loud? Well, you can make it less loud by sticking it on an acupuncture point. That makes it less loud. But it's always going to be kind of loud until you put it on a point. Once you find a point and press the silent treatment button, it's not going to make any noise whatsoever. But you really need that noise to be able to find points. We have in the past, in very specific cases, for people who have autistic children who just can't handle noise at all, we have taken the speaker out of this device. So we take it apart, we rip the speaker out of it, and you will never, ever hear any sound out of it ever again. The downside of that is that you will never, ever, ever hear any sound out of it again. And the sound is incredibly useful when you're trying to hone in on particular acupuncture points. So it can be done, but if we do it, it's a permanent thing. And I don't recommend it unless you are treating a lot of autistic kids and have a fair amount of experience. On scars, light side was negative and left side doesn't matter. And you switch those with passes. Doesn't matter left or right, which is biphasic, which is negative. You can switch them from hand to hand anytime you want to. The side doesn't matter. And you don't have to switch them. You could go negative and biphasic all the way down and then flip the switches and then go all the way up and then flip the switches and go all the way down. This is just my experience after years of doing this, like the best ways to release scars. There are a lot of ways to do it, but this is just the fastest and easiest way. Contraindications for tinnitus. No contraindications for tinnitus. Actually, I treat a fair amount of tinnitus. And my results with tinnitus are sometimes I make it go away. Sometimes I change the pitch, like I make it less loud and I change the pitch. And sometimes I don't affect it at all. I've had cases I've never been able to change with tinnitus, but I've had some that I've gotten rid of. That's going to depend on your skill level and what the tinnitus originated with. Can you use the Dolphin without vagal attachments in the semi-concha of the ear? Yes, you can. Can we help tinnitus with microcurrent? Yes, you can. We actually have protocols for it. Tinnitus is a very specific thing from person to person. Some people have been exposed to explosions and loud firecrackers. Some people have had it for years. Some people have had concussions and had tinnitus. There's a lot of different reasons you might have tinnitus. And I wish I could tell you I knew exactly how each case was going to respond. But in my experience, it's a very difficult thing to treat. You get amazing outcomes sometimes. And sometimes in the cases you never would think you can fix, you'll treat them once or twice and it's just gone. Other cases I've struggled with, usually I've been able to help people. If I haven't been able to get rid of it, I can tone it way down. But I have had cases I haven't been able to fix. So it is a difficult one. But there are a lot of things that go into it: treating scars, treating the spine, treating post concussions, treating emotional stuff, treating around the ears. There's a lot of different reasons reasons for treating different things. Okay. Does that mean that those people who are likely to die from stress-related disease, you should do the vagus nerve protocol regularly throughout the day? Well, everybody's likely to die from a stress-related disease. So what I would do is check your heart rate variability, your HRV, find a device to check it, and see what the norm is for your age, and probably apply vagus nerve stimulation to modify that. But also you have to consider the fact that you may be eating bad food. You may be in a toxic relationship. You may be exposed to toxic mold every day. You may be taking too many antibiotics. There's a million reasons why your heart rate variability might be down. So you need to investigate those things. This is a great device for modulating your heart rate variability, but you need to explore some of the reasons also why you might be having those issues. And some of it's trauma related. There are specific acupuncture points for emotional problems, like grief and anger. And there are specific protocols for PTSD, and there's stuff we use for trauma. So you can certainly treat some of that with acupuncture points. I did not receive the code from previous tutorial on scar tissue I attended. Where is the code for the tutorial will be posted? Eco for the tutorial. You're actually going to get an email. They will send you an email in a few days, and you'll get a code to watch this tutorial again. What's the best to use, white or black ear clips for vagus nerve treatment? You can use both. I tend to like the white ones better because these are actually designed to get down into the ear a little bit better, and the black ones don't tend to get down in there quite as well. They're not bad for putting on the earlobes, but the earlobe isn't really as innervated by the vagus nerve as the tragus or the upper concha of the ear. When you say you may need more than 15 minutes and you did 2 hours, do you have to restart it by pressing the silent button again every 12 to 15 minutes to keep it going? Yes, you do. You absolutely do. So it's going to stop and you're going to have to restart it. And we added that feature some years ago because people were falling. This will make people sleepy, and people were falling asleep with this, and it would keep going for 6 or 8 hours until the battery ran out or longer. They were waking up really groggy in the morning. So yeah, you got to keep pushing that button over again. Let's see what else we have here. I don't see it flashing even when it's on the high setting. That's fine. It doesn't need to flash on the high setting. 2 times you look at the light. When you turn it on to make sure that the battery's good, and when you're finding points. Other than that, don't worry about it. Sometimes it flashes on high. Sometimes it doesn't flash on high. Sometimes it flashes on low. Sometimes it doesn't flash on low. Like if you start trying to go down that rabbit hole, it's just going to confuse you. Does it matter if you use one black one and one white, or must they be the same each time? I watched YouTube that had one of each. Chris, I'm not sure if you're referring to Dolphin Neurostims that are black or ear clips that are black, because there are black Dolphin Neurostims that were made previously. It's the same. I mean, they all work. So you can use 2 different colored Dolphin Neurostims. The current's a little different, but they both work. And ear clips, you can use both colors and it's fine. Vagus nerve stimulation, okay for seizure. Yes, okay for seizures, but not while you're having seizures or during the prodromal phase. If you lower the stress of the body, you lower the chances your body is going to have a seizure. So I would use it to treat the stress side of things. Perfect. So that's how I can see the green light when treating face or neck on myself. You don't really need to. Yes, you can do this. You can use the extension probe like this and turn the Dolphin Neurostim on and see the light. And I can see the light, and I can touch the metal plate, and I can look for acupuncture points, and I can see if the light goes off. So I can do it this way, or I can just listen to the tone. If I get a good high pitch, the light's usually off when I get that. So either way, whatever floats your boat, both work. How many scars can you treat at once? As many as you want to. I do specialized scar treatments, and I may treat 1 scar, or I may treat 15 scars in a treatment. It just depends on how much time I have with the patient. Can this help with neuropathy? Oh, wait a minute. At what point did you say you need to push the big black button? Do I need to hold it, the metal plate, to ensure treatment is working? Yes. Put your thumb on the metal plate and hold the big black button down, and you're doing a treatment. So now I'm doing a treatment. As soon as I release the button, I'm not doing a treatment. So as long as you're holding this down, you're doing a treatment. But as soon as you release it, the treatment's over. And make sure your thumb is on the metal plate and you're touching your patient's skin with your skin. Have you treated burn scars over very large areas of the body? Yes. We have some paper plants down where I live, and they use a lot of steam, and steam has a lot of energy and makes really nasty burns. So I've treated large steam burn scars, and it is quite effective. Can this help with neuropathy? Yes, it can. Depends what the neuropathy is from. I have successfully treated patients who have chemotherapy neuropathy. I've treated patients with Agent Orange neuropathy. I've treated patients with diabetic neuropathy. And most respond quite well. Sometimes there are cases they're either, I guess, too far gone or you've missed something where it doesn't seem to respond. If someone has a neurological stimulator implanted for migraines, is it still safe to use? I would check with the doctor who implanted the device. I generally, most stimulators seem to be fine. I just tell the patient to turn them off while I'm doing this, and it seems to be good. How would you support a compromised endocrine system? One adrenal, no thyroid. Well, you're going to want to release the low back because this is your kidneys in acupuncture. So you're going to treat the shoe points up and down the back, which are each vertebral segment, 2 fingers off the spine, in the erector spinae muscles. Bladder 23 is the kidney meridian. That's where kidneys are innervated. That's your adrenals in acupuncture. So you're wanting to treat on negative to that to release the muscles, which put pressure on the nerve roots. But then you're going to come back and treat on positive to tonify that. You're going to tonify kidney 3, which is the source point for kidney energy, which again is your adrenals. You're going to do vagus nerve stimulation to bring down your overall level of stress on the left ear. You're going to treat the right ear on positive to bring up your energy. You're going to treat all the scars on the body to reduce any stress that has on the autonomic nervous system. You're going to treat the emotional points for any emotional stress that has, because that tends to flare up endocrine issues. You are going to do Zhang Fu balancing out the male and female organs. There's a lot that goes into that. But can it be done? Yes, it can be. And do I know people who do it? Yes. Is it the only thing that you need to do? No, you need to do nutritional stuff and supplements, and there's a whole bunch of stuff you need to do with it, but it's a good start. Oh, with tinnitus, would you do negative on the left ear? Usually I would. That's a good idea. Usually you're trying to bring it down. Often can we do vagus nerve stimulation? How many times per week or month? So I'm 54 years old. I raise 2 kids by myself. I do 10-hour days of therapy. I do vagus nerve stimulation 2 to 3 times a week for about 30 minutes. That seems to work well for me. I know people who are elite athletes who use this after every single workout. So they use it every day after their intense workouts, and it does well for them. People who are very, very sick, they might do this for some hours. The vagus nerve is a finicky thing. It runs differently on everybody, and it affects your system a little differently on most people. That's why we give you, left ear, right ear, wrist, tummy, splitter cable. Play with it a little bit and see what works best for you. That's why we say do it in 5-minute increments. Do you do vagus nerve stimulation regularly throughout the day, or should it be one time before bed? Just trying to figure out if there's a benefit to doing it more than once. Yes, there is a benefit to doing more than once per day. Depends on what my overall stress load is. So some days I wake up, I do positive stimulation on my right ear to kind of get things going in the morning. As the day goes on, as I start getting tired, may do more positive stimulation. But if I'm feeling poorly and I'm trying to boost my immune system, I may do negative polarity for a while. And then at the end of the day, I'll do more of it. So you can use it throughout the day. It's not going to kill you. Here's the thing about using microcurrent. This is really important to remember. Like, this is either going to make you better or it's generally not going to work. So it's a pretty safe modality to experiment with. If you stay within the parameters I gave you, like don't stick it in your eye, don't jam it up your nose and things like that, you're usually pretty safe. So it's generally going to help you or it's not going to help you. Sometimes it will exacerbate your symptoms. Like some people treat a point too long for migraine headaches. So if you treat a point too long and it makes your headache a little bit worse, change the polarity and treat the same point again. It'll bring it back down. I'm specifically going to be letting my daughter use it first for her dysautonomia, POTS, MCS, and EDS. I've seen testimonials saying that this has eliminated people's POTS, but yeah. Yes. So yes, you can use this for those things. And if you need further guidance, you guys are also going to get a link to join our Facebook forum, an invitation. So when you get that, join that. And if you have further questions, ask them there and we can answer them for you. Oh, yes, you were talking about the ear clips. So yeah, white ones and black ones, that's fine. What's the difference between small button and large black button for treatment? All right. Large black button, I have to push it down. As long as I hold this, I'm doing treatments. When I release it, treatment is done. If I push a small black button, the unit goes silent. I don't have to pull the button down. Like it's automatically treating. So it's going to run for about 15 minutes. When it stops, it reverts back to this search phase and you hear a steady tone. So it'll go silent and treat for 14 to 15 minutes, and then it'll revert back to the search phase. I'm assuming you can treat epidural site pain. Oh, absolutely. Having worked in women's health, a lot of women can tell you exactly where they had their epidural, even if it was 20 years ago, they can put their finger on it. And if you treat that, I have seen that clear up severe low back pain and nerve pain down people's legs and weird problems where people were passing out. Treating that one teeny tiny little area where they had the epidural can be incredibly useful. I don't have time to go into the details, but if somebody tells you they can feel where their epidural was, you treat it like a scar. Absolutely treat it like a scar, and it will usually in 1 to 2 treatments get rid of that discomfort, and usually has systemic implications. Things tend to work better after you do that. All right, guys, we are at almost 9:15, so I need to call it an evening because I need to go home and walk my dog and get my kids to bed. Thank you guys for coming out this evening. If you would like to watch this tutorial again, you can sign up for it again. I do this every couple of weeks. Some days I wear a black t-shirt, sometimes a white t-shirt. Sometimes I say things a little bit differently. So it's worth tuning in if you have further questions you want to ask. Do look for the link to watch us over again in case you missed anything. It's a lot of information compressed into a really small period of time. And also look for the invitation to join our Facebook forum, because that's a great place to ask questions and follow threads where people are actively doing treatments and want to share with you their successes or their failures and want to ask advice on things. So thank you guys for coming out this evening. Let me double check here and make sure I don't have anything else. All right, I think we're good here. So with that said, I'm going to end our tutorial session here, and I will see you guys next time. Do come out and catch us at a live workshop. Those are a lot of fun. They're usually 2 days on weekends, and you will get a lot of really good information. So you guys have a nice evening.